Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, everybody in the pool will dive in with tips on how rehab can be relaxing when working out in the water. Then be drawn to the beauty of membership at the Cleveland Museum of Art. Could your mate manage the money without you? We'll dispense common sense. And how to boost your benefits with Social Security.
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Do you have aches and pains that are weighing you down? Then lighten up with a kind of therapy that's making a big splash. We've waved David Schell and Mimi Pekarik over to help us wade into the topic of aquatic therapy. David and Mimi are both with Breckenridge Village, a not-for-profit retirement community in Willoughby. David is the executive director, and Mimi is the director of outpatient therapy at the Veal Wellness and Aquatic Center. So welcome again to the show.
Thank you. It's nice to be here.
Well, Mimi, let's start with you. When we're talking about using a pool to appease the pain, we're not all wet, right?
No, not at all. A lot of people think that aquatic therapy is swimming. And if you're not a swimmer, you don't want to go into the pool for aquatic therapy. But honestly, Lori, most people stay vertical in the water, not horizontal. Okay. So most of our therapy is done as exercises that some of them are very similar to the same exercises you do on land, but in the water it's much more comfortable.
Okay, well let's dive into more of a description about how this aquatic therapy works.
The benefits of the water, what makes it different is on land you have the air that you're dealing with and gravity. When we put you in the water, we eliminate gravity so the joints feel much, much more comfortable. In a warm water pool, our pool is 88 to 90 degrees, so nice. it's bath water. It soothes your joints and it also supports you so that those joints can move much freer and release a lot of the pain.
Okay, well, and David, now it sounds like from what Mimi is describing, you need a particular kind of pool, like the kiddie pool in the backyard is probably out, right?
It doesn't work, doesn't work. With this pool, we worked with Mimi and a lot of other therapists and designers on really coming up with a pool that met the needs of folks that were having rehab and following post-surgery. So it has a ramp, there's no barriers to access, so if someone even needs a water walker or something following back surgery or knee replacement, they can get in the pool.
Oh, this is a picture of the pool.
There's a picture of the pool. And then the middle section is about 4 foot to 4 foot 8 inches for exercise where they're water walking or other exercises. And then there's a deep end that's 6 foot deep where it free weights the entire spine. And then we were able to have a wonderful filtration system that's actually an earth mass system. So we use a lot less chlorine so there's no smell, aches to the lungs or on the skin. And then Mimi said the temperature, which is absolutely wonderful. It's about the perfect environment for aquatic therapy.
That's fantastic. So Mimi, what kind of conditions respond to this kind of therapy?
Many of the older adults that we treat don't just have problems with one area of their body, they have multiple areas. So oftentimes if you have back problems and shoulder problems or back problems and knee problems, by getting you in the water, we can truly treat more than one area at the same time, which is very beneficial. So a lot of our patients have different kinds of back problems. They have arthritis, chronic fatigue problems where they can't exercise on land. Sometimes folks that are younger, women that are pregnant can also benefit from aquatic exercises when they can't do the same level of exercises that they used to do on land. And those with obesity oftentimes can do a much higher level of exercises because they can't on land because of their size. So it's very, very beneficial.
Okay, and David, how about those who aren't a part of maybe Breckenridge Village? Can they get in on the act as well?
Absolutely, and I think that's the wonderful thing about not only our new inpatient rehab area, but also the outpatient rehab area, that we finally have enough space to be able to accommodate anyone. And so all they need is a physician's prescription, and then just give us a call, and Mimi and the staff will work with them through
And do some free
aquatic
information
therapy.
for people as
We
well?
do. We've got a booklet that's available, and that we're happy to send that to anyone, and please just ask for it, and we'll make it available, or give us a call.
So residents, non-residents alike, we
Yes.
can get some good information here. So are you ready to wear your water wings for a workout that could lead to wellness? Then give Breckenridge Village a call. The number's next. My thanks to David and Mimi for whetting our appetite for aquatics.
Thank you.
To find out more, call Breckenridge Village at 440-954-8359 or visit their website, www.breckenridgeohio.org. Next, membership has its privileges.